Obviously, you will moderate from start to finish. Uh, Production of lesson, reduce the speaker, then seriously, then questions. Job.
Morning, everyone. The topic for today's presentation is anticholinergic psychiatry. This presentation will be presented by
Good morning, everyone. My name is Mahima Goyal, and I'm MBBS intern from 2018 batch. And my moderator is Dr. Abhishri. She's PG2, and my topic is anticholinergics and psychiatry. The overview of my slide will be introduction. What are the anticholinergics? What are the type of anticholinergics? What are the uses of anticholinergics in CNS? Extrapyramidal symptoms, uses of anticholinergics in EPS. What are the side effects or interactions of anticholinergics in psychiatry? So, what are anticholinergics? Anticholinergics are also known as antimuscarinic drugs, parasympathetic. Anticholinergics are also known as antimuscarinic, parasympathetic, or atropinic drugs. They basically restrict or block the actions of acetylcholine on the autonomic receptors, which basically are exerted in CNS. So, if we talk about the receptors, there are nicotinic and muscarinic receptors. Muscarinic receptors are from M1 to M5, and M1 receptors are mainly present in CNS and stomach. M2 are present on heart, and M3 are present on rest of the organs. And nicotinic receptors, we mainly do not include them in anticholinergics because they causes the reversal of the NMJ junction drugs. So we will not discuss it here. What are the type of anticholinergics? Type of anticholinergics can be divided as I told you already, antimuscarinic and nicotinic drugs, or natural semisynthetic and sympathetic compounds, in which we can see there are midratic drugs, psychoselectives, and anti-Parkinsonism drugs. So my topic is in psychiatry, so I will focus on the anti-Parkinsonism or the drugs in CNS. With the uses of anticholinergics in CNS, the first entity which I'll cover is mountain sickness. So when we go to the high altitude due to motion, our vestibular apparatus is stimulated and it sends information to the CTZ junction, which is basically a vomiting center, which leads to vomiting. So we use hyoscine or scopolamide, which is a CNS depressant. It basically inhibits the transfer of information to the CTZ and thus prevent the vomiting. The next entity is drug-induced Parkinsonism. All the antipsychotic drugs basically causes the Parkinsonism and vice versa. All the anti-Parkinsonism drugs leads to psychosis, which is due to the imbalance between the acetylcholine and the dopaminic levels in our brain. So central anticholinergic drugs, which are as named benzhexol, benztropine, bipyridine, and procyclidine, they basically enters the blood-brain barrier and restore the imbalance caused between dopamine and acetylcholine. And they also inhibit the peripheral side effects. We can use alternative, which is highly used in our institute, that is promethazine. It also crosses the blood-brain barrier and blocks the acetyl. In poisonings, like OP and carbamate poisoning, atropine is a drug of choice. We give it every 5 minutes till the atropinism occurs, and these are the 3 reliable markers which we see for atropinism. And we also give atropine as a drug of choice in early mushroom poisoning. Now, for the main psychiatric topic, typical antipsychotic drugs like haloperidol, like drugs, they basically are strong blockers for D2 receptors and they increases the dopamine level. So if we give them in an overdose, they strongly block the D2 receptors and lead to extrapyramidal symptoms, which are presented over here. The extrapyramidal symptoms are acute dystonia, Parkinsonism, akathisia, neuroleptic malignant syndrome, and tardive dyskinesia. So in pseudo-Parkinsonism, as we all know, it can lead to stoop posture, supplemental rigidity, bradykinesia, tremor at rest. In akathisia, there is restless trouble in standing and pacing the floor. Acute dystonia, there is facial grimace and voluntary upward eye movement. And in tardive dyskinesia, main features are sucking or smacking movements of the lip, facial dyskinesis. So the drug is benzhexol. It is a drug of choice for Parkinsonism and acute muscular dystrophy, and it can be also used in akathisia and malignant neuroleptic syndrome. This is contraindicated in tardive dyskinesia because in tardive dyskinesia there is something known as supersensitization of the D2 receptors which occur, and if we block the drug, the dopamine can act in very high amount and cause undesirable features in patients. The side effects or drug interactions with anticholinergics are clozapine, when given with anticholinergics can worsen the side effects, that is constipation and cognition, because clozapine also work in some places like anticholinergics. Anticholinergic side effects, anticholinergic can also affect in disorder of arousal, or it can also lead to sexual dysfunction. And if in a patient of Parkinson's disease, there are features of psychosis, we should stop the drug uh, like anticholinergics and dopamine agonist, and we should monitor the patient subsequently with motor deterioration. If the patient present with motor deterioration, we should start again the patient with anticholinergics and dopamine. So we need to balance the drugs according to psychosis or the motor features in the patient. My reference was from this book. Thank you so much. Yes, sir. Uh, uh, yes, sir.
don't know. Mental sickness, right? It is by not by I think it is by the motion, like the circular travel, motion sickness. That is where the vestibular apparatus gets stimulated
Yes.
because of north and brown. What are the anticholinergic? You've been in there for how long?
Sir, tomorrow is my last day.
What anticholinergic you use there?
So promethazine. Yes, sir, haloperidol. नहीं. Sir,
Yes.
No.
In your list, is it there? Price study.
no, sir.
ये रखे हैं पेट के लिए ऑप्शन नहीं है आप ये करो मेरे को फटाफट से, ठीक है एक्सपेक्ट in terms of significant time so we also okay we'll give you certificate okay
Yes.
thank you for
Thank you.